My name is Erin Wild. This is case formulation number 1 for nursing 731. So this is a patient that is coming to us. He is a male. He's a U.S. Marine, has completed 2 tours of duty in Iraq and has returned stateside within the past couple of months. This patient is today reporting that he is struggling with reintegration to society, feels like he does not belong, feels helpless. He is also experiencing, lack of motivation, has no longer exercise, is complaining of chronic pain, chest, back, and stomach that had started when he was overseas and has not resolved as of yet. The patient has a recent breakup with his partner. He is also reporting insomnia, difficulty falling and staying asleep, as well as recurrent nightmares. He does admit to self-medication with marijuana and alcohol to help him sleep or to help him forego the nightmares. The participant has a lack of a support system and has not sought treatment as of this time. So for him, in doing his initial interview and completing assessment tools, my primary diagnosis is PTSD, and I have co-occurring diagnoses for him of depression, generalized anxiety, alcohol dependence, substance use. For the plan of care, according to the U.S. Department of Veterans Affairs, the clinical practice guidelines for PTSD, first-line treatment is going to be cognitive behavioral therapy, or CBT. CBT can be concurrent with pharmacologic intervention, in which case the clinical practice guidelines for the Department of Veterans Affairs are sertraline and then prazosin for the nightmares. So in the plan of care with this patient, I would have him establish or identify what the issue for him is, what is causing him, the most upset at this point. And then we would go ahead and establish what are his goals for his plan of care, his treatment, what would help him feel better, what does he want to see come out of our plan together. It's going to be important, as he has identified self-distrust and distrust in others, that we do establish shared decision-making for him, so that he, reestablishes, hopefully, his trust in providers, as he is coming from a very authoritarian environment with the U.S. military, and sometimes distrust in authority figures is prominent. So after he identifies his goals, we would set homework, so to speak, for him, or ways that he can navigate while he is at home to help himself in his treatment plan. The first technique that I would utilize for him is reattribution of guilt and self-blame, as this is something that he has expressed as a large concern for him. He wonders what would have happened had he done things differently while he was overseas. He feels like he is to blame. So if we can assist him in redistributing the responsibility and understanding that what occurred while he was overseas is not his fault. He is not to blame for how that played out, or making any different decisions so that things may have turned out differently. So just assisting him in redistributing the understanding that that was not his responsibility. He is not to blame. Also, in conjunction with that, I would recommend utilize thought stopping. This is a technique that can be either with gentle tactile stimulation. You can use pinching themselves, utilizing a rubber band to snap against the skin, so that it kind of jars the patient from perseverating on what it is that is bothering them, and in that thought loop that they are stuck in. It helps them to recenter and shift their focus. Aside from utilizing tactile stimulation, you can have them repeat to themselves out loud, stop or stop it, and that will help them shift their focus as well, so that they can again recenter and pull themselves out of the loop of perseverating on the event that is causing them the trauma. Thirdly, for this patient in particular, I would recommend a daily exercise plan. This is something that was important to him previously, so I would have him implement that. While it may not be as intense as it was previously, it could be something simple. This will help him with a routine, help increase motivation, get him up, get him moving daily, give him something to look forward to. It can also help decrease pain, improve strengthening. Serotonin and endorphins can improve mood. So these are all positive for him. I would see him back in 2 weeks' time to identify, is the plan helpful and what changes do we need to make? Are there additional modalities that we can implement to help him further in his plan of care and his treatment?